Astigmatism correction and the long-term impact of laser eye surgery. Do you squint to read street signs or feel strain after hours at your screen, even with glasses? You might have astigmatism, a condition affecting nearly 1 in 3 people. Astigmatism is a common vision condition that can cause blurred or distorted vision. This article provides essential information about astigmatism, covering its causes, symptoms, and various treatment options. We will also delve into the crucial long-term considerations of laser eye surgery for your overall eye health and vision journey. What is astigmatism? Astigmatism is a type of refractive error that occurs because the front surface of your eye, the cornea, or the lens inside your eye has an irregular, mismatched curve. Imagine a perfectly sighted eye as having a cornea shaped like a perfectly round basketball. In contrast, an eye with astigmatism has a cornea or lens shaped more like a football or the back of a spoon, it's steeper in one direction than the other. This uneven shape prevents light from bending uniformly as it enters your eye. Instead of focusing precisely at a single point on your retina to create a sharp image, the light rays scatter and focus at multiple points. This optical imperfection is what causes vision to appear blurry, distorted, or wavy at all distances. Types of astigmatism. There are 2 primary types of astigmatism. Corneal astigmatism. This is the most common form, occurring when the cornea itself has an irregular, non-spherical curve. Lenticular astigmatism. This type arises when the lens inside the eye possesses mismatched curves. It can sometimes be associated with the development of cataracts. Common symptoms of astigmatism. The presence of astigmatism can manifest through several noticeable symptoms, including blurred or distorted vision at any distance, near, intermediate, or far. Eye strain or discomfort. Headaches, particularly after tasks requiring visual focus. Difficulty with night vision, such as perceiving glare or halos around lights. Frequent squinting to try and clarify vision. Causes of astigmatism. While the precise cause of astigmatism is often unknown, several factors are commonly associated with its development. Hereditary factors. Astigmatism is frequently present at birth and can have a familial predisposition, meaning it often runs in families. Eye injury or surgery. Trauma to the eye or certain types of eye surgery can sometimes induce or alter astigmatism. Keratoconus. This is a less common progressive eye disease where the cornea thins and gradually bulges outward into a cone-like shape, leading to severe irregular astigmatism. Aging. The natural aging process can lead to changes in the shape and elasticity of the cornea, which can contribute to the development or progression of astigmatism. Treating astigmatism. Solutions for clearer vision. Fortunately, astigmatism is a highly treatable condition. The most common and effective treatment options include eyeglasses. Prescription eyeglasses are custom designed with specific lenses that compensate for the irregular curvature of the eye, ensuring light focuses correctly on the retina. Contact lenses. Special, toric, soft contact lenses are available, engineered with specific orientations and curvatures to correct astigmatism. Rigid gas permeable, RGP, contact lenses can also be highly effective for certain types of astigmatism. Orthokeratology, Ortho-K. This non-surgical approach involves wearing specially designed rigid contact lenses overnight. These lenses gently and temporarily reshape the cornea while you sleep. Upon removal in the morning, vision is temporarily corrected without the need for glasses or contacts during the day. This effect is temporary, requiring consistent overnight wear to maintain the correction. Refractive surgery. Procedures like LASIK, PRK, and SMILE utilize advanced laser technology to permanently reshape the cornea. These surgeries aim to correct the refractive error, significantly reducing or even eliminating the need for corrective lenses. It's crucial to note that medications such as traditional eye drops cannot fix or permanently correct astigmatism. Eye drops may alleviate associated symptoms like dryness or irritation, but they don't address the underlying structural irregularity of the eye. Astigmatism and aging, a common occurrence. Aging is a significant factor in the prevalence and characteristics of astigmatism. While astigmatism can be present from birth and often stabilizes in young adulthood, significant age-related changes typically begin after the mid-40s. Studies indicate a high prevalence of astigmatism in older adults, often affecting 40% to over 70% of individuals, depending on the specific research criteria. A notable age-related shift occurs in the type of astigmatism observed. With the rule, WTR, astigmatism, where the steepest curvature of the cornea is vertical, is more common in younger individuals. Conversely, against the rule, ATR, astigmatism, where the steepest curvature is horizontal, significantly increases with age and becomes more predominant in older adults. This shift is believed to be due to age-related changes in corneal elasticity and the effects of eyelid tension over time. The magnitude of astigmatism can also increase with age, particularly the ATR type. Furthermore, the development of cataracts, which are also very common in older adults, can induce or significantly alter existing astigmatism. Understanding keratoconus and its relationship with astigmatism and contact lenses. Keratoconus is a progressive eye disease where the cornea thins and bulges outward into a cone shape, leading to severe irregular astigmatism and impaired vision. What causes keratoconus? The exact cause of keratoconus isn't fully understood, but it's believed to be a combination of genetic predisposition. Approximately 1 in 10 people with keratoconus have a family history of the condition, indicating a genetic link. It's often associated with certain systemic genetic disorders like Down syndrome or Ehlers-Danlos syndrome. Environmental factors. Chronic, vigorous eye rubbing is the most consistently linked environmental factor, as it can cause mechanical trauma to the weakened corneal tissue. People with keratoconus often have allergies or other atopic conditions that lead to itchy eyes and subsequent rubbing. Other potential contributing factors include chronic inflammation and oxidative stress in the cornea. Can contact lens wear cause keratoconus? While contact lens wear doesn't directly cause the genetic predisposition to keratoconus, it can be a contributing factor or exacerbate the condition in susceptible individuals. Eye irritation and rubbing. Poorly fitted contact lenses or those that cause discomfort, irritation, or dry eyes can lead to increased eye rubbing. If an individual is genetically predisposed to keratoconus, this chronic rubbing can initiate or accelerate the progression of the disease. Modern contact lens designs, particularly highly oxygen-permeable RGPs and scleral lenses, aim to minimize irritation and hypoxia. Can fixing contact lens fix astigmatism caused by keratoconus permanently? No, fixing the contact lens fit doesn't provide a permanent fix for the astigmatism caused by keratoconus. Here's why. Masking, not curing. Specialized contact lenses for keratoconus, like rigid gas permeable, RGP, lenses, scleral lenses, and hybrid lenses, work by creating a smooth, new optical surface over the irregular, cone-shaped cornea. The space between the lens and the eye is filled with tears, which neutralizes the corneal irregularities. While this provides significantly improved and clearer vision while the lens is worn, it doesn't change the underlying shape of the cornea. As soon as the lens is removed, the uncorrected, blurry vision caused by the irregular cornea returns. Disease progression. Keratoconus is typically a progressive condition, meaning the cornea can continue to thin and bulge over time. Contact lenses don't halt this progression. As the disease advances, contact lens prescriptions and fits will need to be updated to maintain optimal vision and comfort. To address keratoconus and its associated astigmatism more permanently or to halt its progression, other treatments are necessary. Corneal collagen cross-linking. CXL. This is currently the only treatment that is proven to slow or halt the progression of keratoconus by strengthening the corneal tissue. It involves applying riboflavin eye drops and then exposing the cornea to ultraviolet, UV, light. Intracorneal ring segments, intact small plastic inserts surgically placed within the cornea, can help flatten and regularize its shape, which may improve vision and make contact lens wear more effective. Their effect is generally long-lasting. Corneal transplant, keratoplasty. In advanced cases where other treatments are insufficient, a surgical corneal transplant replaces the diseased cornea with healthy donor tissue. This is a permanent surgical solution, though patients may still require glasses or specialized contact lenses afterwards to achieve optimal vision. Effectiveness and potential issues of surgical correction for astigmatism. Surgery for astigmatism, particularly laser refractive surgeries like LASIK, PRK, and SMILE, is generally very effective for a large percentage of suitable candidates. These procedures aim to permanently reshape the cornea to correct its irregular curvature, allowing light to focus properly on the retina. It's important to note that laser eye surgery can simultaneously correct both nearsightedness, myopia, and astigmatism in a single procedure, as the laser is programmed to apply a customized reshaping pattern addressing both refractive errors. Primary surgical options and their effectiveness. 1. LASIK, laser-assisted in situ keratomilus, highly effective for correcting mild to moderate astigmatism, often alongside nearsightedness or farsightedness. Patient satisfaction rates are very high, 92 to 98%, with a significant majority achieving 20/20ths vision or better. Recovery is typically quick. 2. PRK, photorefractive keratectomy, equally effective as LASIK in correcting astigmatism, with comparable long-term visual outcomes. Initial recovery is slower with more discomfort, but it's preferred for thinner corneas or active lifestyles as it avoids creating a corneal flap. 3. SMILE, small incision lenticule extraction, a newer procedure effective for myopia with astigmatism. It involves a smaller incision, potentially leading to less postoperative dry eye. 4. Implantable Collamer lenses, ICLs, phakic intraocular lenses, excellent for correcting high levels of astigmatism and other refractive errors outside the typical laser range. These lenses are implanted inside the eye and are reversible. 5. Refractive lens exchange, RL/cataract surgery with toric IOLs, involves replacing the natural lens with an artificial toric intraocular lens, IOL, to correct astigmatism, often performed in older patients developing presbyopia or cataracts. The best surgical option for you will depend on a detailed assessment of your eye health, prescription, corneal thickness, and lifestyle, all of which your surgeon will discuss to help you make an informed decision. Potential issues and side effects of laser eye surgery. While generally safe, like any surgery, laser eye procedures carry potential risks and side effects. Most are temporary, but some can be persistent or serious. Common, usually temporary, side effects. Dry eyes, the most common side effect, often resolving in weeks to months, but can be persistent for some. Visual disturbances, glare, halos, rings around lights, and starbursts, spikes of light, are common initially, especially at night, and usually improve over time. Discomfort/pain, mild with LASIK, more significant in the first few days with PRK. Temporary blurry or fluctuating vision, vision may be hazy or fluctuate during the healing period. Light sensitivity, photophobia, common during initial recovery. Less common, but more serious, complications. Undercorrection or overcorrection, remaining refractive error or an induced opposite error, potentially requiring a secondary procedure, enhancement. Regression, gradual return of some refractive error over time, more common with higher initial prescriptions. Infection, rare but serious risk, requiring prompt treatment. Inflammation, diffuse lamellar keratitis, DLK, an inflammatory response under the LASIK flap, usually treatable. Corneal flap complications, LASIK only, rare issues like irregular or displaced flaps, or epithelial ingrowth. These are significantly reduced with modern bladeless LASIK. Corneal ectasia, a very rare but severe complication where the cornea progressively thins and bulges after surgery, similar to keratoconus, potentially requiring cross-linking or transplant. This emphasizes the importance of thorough preoperative screening. Induced astigmatism, in rare cases, uneven healing can cause new or worsened astigmatism. Vision loss, extremely rare, but severe complications can lead to a permanent decrease in best-corrected vision. Long-term implications of laser eye surgery for future eye health. A critical consideration when weighing refractive surgery is its potential impact on the diagnosis and treatment of other eye diseases that may arise later in life, particularly age-related conditions like glaucoma and cataracts. While prior laser eye surgery doesn't prevent future treatments, it can introduce complexities. Impact on glaucoma diagnosis and treatment. Glaucoma is characterized by optic nerve damage, often linked to high intraocular pressure, IOP. Altered IOP measurements, laser eye surgeries thin and reshape the cornea. Standard tonometers, which measure IOP, rely on the cornea's biomechanical properties. A thinner, altered cornea can lead to an underestimation of the true IOP, potentially masking early glaucoma or delaying diagnosis. Ophthalmologists are aware of this and use specialized formulas and direct optic nerve assessment, e.g., with OCT, to mitigate this risk. Steroid-induced IOP spike, steroid eye drops, common post-surgery, can temporarily raise IOP in susceptible individuals, potentially impacting the optic nerve if not monitored. Glaucoma surgery. Previous refractive surgery generally doesn't preclude future glaucoma treatments, but the history must be communicated to the surgeon. Impact on cataract surgery. Cataracts are common with aging and will eventually affect most individuals who had laser eye surgery earlier in life. IOL power calculation challenges. This is the most significant complication. Standard formulas for calculating the power of the artificial intraocular lens, IOL, to be implanted after cataract removal rely on the natural corneal curvature. Since laser surgery permanently alters this curvature, standard formulas can be inaccurate, increasing the risk of a refractive surprise, e.g., residual nearsightedness or farsightedness. Experienced surgeons utilize advanced diagnostic tools, specialized IOL formulas designed for post-refractive eyes, and ideally, original presurgical records to improve accuracy. Newer IOL technologies also offer more adjustability. Key takeaways: weighing the decision for eye surgery. Deciding on laser eye surgery for astigmatism, nearsightedness, or farsightedness is a significant personal choice with both short-term benefits and long-term implications for your eye health. Here are the crucial points to consider. 1. Laser surgery is effective but permanent. Procedures like LASIK, PRK, and SMILE are highly effective at correcting refractive errors and providing excellent vision, often correcting both nearsightedness and astigmatism in a single session. However, these are permanent alterations to your eye's structure. 2. It's not a cure for aging eyes. Even after successful surgery, your eyes will continue to age naturally. You will still likely develop presbyopia, the need for reading glasses, typically in your 40s, and cataracts, clouding of the natural lens, common in older age. The surgery addresses existing refractive error but doesn't prevent these future conditions. 3. Complications for future eye care are a real concern. Glaucoma diagnosis. Previous laser surgery can make accurate intraocular pressure, IOP, measurement more challenging, potentially masking early signs of glaucoma, a sight-threatening disease. Your eye doctor will need to take this history into account and use specialized methods for monitoring. Cataract surgery complexity. this is perhaps the most critical long-term implication. The permanent reshaping of your cornea by laser surgery significantly complicates the calculation of the precise power needed for the artificial lens, IOL, during future cataract surgery. This can lead to less predictable visual outcomes and a higher chance of needing glasses for distance vision even after cataract surgery, which can be disappointing for someone who pursued surgery for spectacle independence. Alternatives exist. For most people, glasses and contact lenses offer effective, safe, and entirely reversible ways to correct vision without the surgical risks or long-term complexities. Thorough evaluation is paramount. Given these considerations, laser eye surgery isn't a procedure to be undertaken lightly or, unless you have to, for specific lifestyle or medical reasons. A comprehensive evaluation by a highly qualified and experienced ophthalmologist is essential. They should fully discuss not only the candidacy and immediate risks but also the detailed long-term implications, including how it might affect your eye care for conditions like glaucoma and, particularly, cataracts. If you choose to proceed with refractive surgery, it's extremely important to keep all your pre- and post-operative eye records indefinitely. These documents, especially original prescriptions and corneal measurements, are invaluable for any future eye care, particularly for accurate IOL calculations if you develop cataracts later in life. Inform all future eye care providers about your history of laser eye surgery. This ensures they use appropriate diagnostic techniques and interpretation methods. Whether you're exploring treatment for mild astigmatism or considering refractive surgery, knowledge is your best lens. Understand the trade-offs, ask your provider the tough questions, and choose the path that protects both your present and future vision.